What are the basic pregnancy tests that you need to do in pregnancy? Every patient should do this, and these are something which countries all over the world have agreed upon, and they serve us. And we do these tests because either we want to monitor these things in pregnancy or there is a cure to prevent something. So these tests are done during your booking visit, and booking visits are different in every country. In UK generally they start at around 11 to 14 weeks, and that's because that's the time when we know that this pregnancy is not going to miscarry. This is going to be a healthy pregnancy. So if the government is going to pay for this test, then it needs to be done around this time, or it can be done later on also. It's not like urgent to do it right away. Even in private, when your doctor tells you the moment you're pregnant do all these tests, it's really not required for you to do all of these tests right then and there. You can always do it later on. It's not an urgent thing, but it's required for you to do these tests throughout 9 months, because there are many things that we are going to monitor, at least with these basic tests. So the first is hemoglobin, and this is a part of CBC, a complete blood count. Hemoglobin we need to know because over 9 months generally our hemoglobin drops, and it is preventable, it is correctable, because we have 9 months to correct it. Anemia in pregnancy, hemoglobin low, can have a lot of complications in pregnancy. So to prevent that, we do the hemoglobin. A part of your CBC also comprises of platelets, because there are certain conditions in which the platelet count comes low in pregnancy, and we might not be able to correct it, but it's like a part of our monitoring. We need to have a baseline platelet value. The next blood test is a blood group. Blood group number 1, because in case you need blood transfusion, we might want to know your blood group. So that's number 1. And secondly, if you are a negative blood group, you might need an injection, especially if your husband is positive blood group, then we might need to give you an anti-D injection. It's not meant for everyone, only for Rh negative blood groups, as in O negative, B negative, A negative, AB negative, these blood groups. Then the next blood test that we do is a random blood sugar, to know if you have diabetes right now. So there are values of every blood sugar that is calculated, and accordingly we consider whether you might have diabetes. So it's a very good screening test. The even better screening test to see if you have diabetes at any point in pregnancy is a fasting blood sugar, but again this varies from country to country. So fasting blood sugar needs to be at least 8 to 10 hours fasting overnight, and then there are cutoff values, so your doctor will tell you that. HbA1c is not actually done by everyone, but especially those who are at risk, they might do it, but this does not come in part of your booking blood test. The next one, we do a urine culture, because pregnancy can have asymptomatic urine infection, as in you might not have any complaints, but there's a urine infection which is growing, and we want to catch it because it can affect the kidneys, and if your kidneys are compromised, your baby gets compromised. So urine infection is one of them. Then we check for 4 infections in pregnancy. One is HIV in pregnancy, because there is treatment for that. Then we check for syphilis in pregnancy. We check for hepatitis B in pregnancy, because there is a vaccine and immunoglobulin that you need to give the baby after delivery in case you're positive. And also rubella in pregnancy, because there is something called as congenital rubella syndrome which can happen, and it is preventable in case you're not immune to rubella like we were given MMR vaccines, and rubella vaccine was given to most people, but I think before 1980s anyone who was born before 1980s, they might have not received that vaccine, and it is still available. I personally have not seen congenital rubella syndrome happen yet, but we still do this test. Apart from this, we don't do any other blood tests as such. Then the next step is the GTT at around 24 to 28 weeks. You can do GTT up to 31 weeks as well. So these are the basic blood tests that every pregnant woman should do. They are expensive, especially if you don't have insurance, and even if you have insurance, be careful to do these tests with with a doctor with whom you are going to deliver, because otherwise if you change your doctor and you go to another doctor, that doctor might do again all these tests and it can be an expensive affair. So always have these reports with you. Most doctors will give you a antenatal card in which all this information is mentioned, and if they don't give you an antenatal card, then just ask for your reports. You have paid for it or your insurance has paid for it and it's your right. So those are the tests that you need to do.